Do you have Mast Cell Activation Syndrome? Put a finger down version, criteria 2. Put a finger down if you have had burning and or cramping abdominal pain of unknown cause and or reoccurring or continuing diarrhea, also for unknown cause, and or frequently intense gassiness independent of diet with or without accompanying nausea. Put a finger down if you have had episodically occurring burning and or choking chest pain attacks, which are often experienced as life-threatening, and any EKG that you get shows that things are normal. Put a finger down if you've had bladder pain or pelvic pain that's accompanied by the painful desire to always void your bladder, but you never have a UTI. Put another finger down if you have constant feelings of burning in your skin or pins and needles and or numbness in random areas, and this does not respond to treatment by any sort of pain medication. Put a finger down if you have skin flushing, hives, random itching or swelling of your skin randomly but episodically. Put another finger down if you have fatigue so bad, fatigue attacks that you literally cannot open your eyes and all of your other hormones are mostly normal. Put another finger down if you have episodes of low blood pressure where you faint or have near fainting episodes and your heart races in ways that it feels like you're having a panic attack. Also put a finger down if you have dermatographism, which is where you draw a line on your skin and then a few moments later it starts showing up like a hive and is very itchy. If you've put more than 2 fingers down on this first hand, then congratulations, you've met the major criteria of consensus 2 criteria for diagnosis of MCAS. Now we're going to go over to the second hand over here. Put a finger down if you've ever had a bone marrow biopsy or any other biopsy of any other organ that have found there was abnormal morphology or any abnormal conglomeration of mast cells. I'll talk about this one a little bit more, but if you've ever had a colonoscopy or an endoscopy and they've done a biopsy, you can go back and ask the lab to look at it to see if there's any histological evidence of mast cells. Put a finger down if your mast cells in the bone marrow biopsy have shown any sort of abnormal surface proteins like CD2 or CD25. Put another finger down if they've detected any sort of genetic change in the mast cells from the blood, bone marrow, or those biopsies from any other organ. Put another finger down if you've ever had a baseline tryptase measured and then a tryptase measured during your flare, and the flare one was shown to have 20% increase plus 2 nanograms per milliliter from your baseline. Or you've had a N-methylhistamine in your urine that was shown to be high, heparin in the blood, chromogranin A in the blood, or other mast cell specific mediators like leukotrienes and prostaglandin D2. Put another finger down if you've ever taken antihistamines or mast cell stabilizers and have found that these make the symptoms on the first hand go away. If you've put any fingers down on this other hand, congratulations, you've now met one minor criteria of the consensus 2 diagnostic criteria. This establishes a diagnosis for MCAS. And this is based off the consensus 2 criteria that was put forward by Afrans and Molderings et al. First in 2011, and then it was revised in 2020. The revision in 2020 adds the last minor criteria, which is that the response to an antihistamine or a mast cell stabilizing agent counts as a minor criteria towards the diagnosis of MCAS. Now, this is widely criticized as the consensus criteria that is easier to meet the diagnosis of, which can promote overdiagnosis, which is why if you're using this diagnostic criteria, ruling out of conditions is really important. If you'd like to know more, if you'd like your doctor to know more, I recently came out with an online course. The link is in my bio over here. That is on the diagnosis and management of Mast Cell Activation Syndrome. It goes over the diagnosis of Mast Cell Activation Syndrome with all the criteria in the last decade and the most recent revisions of that criteria, as well as the diagnosis, as well as the management, both in pharmacological agents and in natural agents.